want you to get, and you guys online, you've done this with Mrs. Gerritsen up until this point. We're going to start here. And the one I want you to get here is in orange. The hymen, in your terms, is the cherry. All right, up inside the vagina, there's a layer of tissue. The first time a girl has sex, that tissue is torn. Okay? And in our terms, we say, taking her virginity, or I hear from guys, taking the cherry. All right, and that's what this is. We live in a world where girls are physically active. We play sports, we ride bikes, we skate, we do all that stuff. It's not abnormal for a teenage girl to have this torn just because of the activities she's in.
I did water skiing.
Okay? Not abnormal. In my grandmother's day, if my grandparents had been together for the first time sexually and my grandpa had discovered that my grandma's hymen was torn, that was grounds, in some cases, for automatic cancellation of the marriage because she had not waited for him. Now, in that time, it was not expected for him to wait for her, but it was for her to wait for him, okay? So in our area, in our time period, yes, sports can tear it. A lot of girls will go in, like before her wedding night, and will have the doctor surgically cut this because when it tears, it does hurt. Okay? And I'm sure that all of your mothers, all your parents have begged you to wait until later to have sex for the first time, and there's lots of reasons. Okay? First one, your mama doesn't want to be a grandma at this point. Okay? They don't want that. They also don't want you to go through the pain of being just somebody else that some guy writes on their list. Okay? And I'm sorry guys, it makes you sound bad. But we know there are guys whose sole purpose is just to add another girl to the list. And if that's the case, it's all about him. He's not going to protect you, all right? And it will hurt. And no girl needs that first time having sex to be a traumatic, painful experience, okay? When this tears, yes, there is pain, yes, there is blood. That's normal, okay? So girls, if you're with this person that you've waited for, and there's a love relationship, and he's caring about you and you're caring about him, yeah, it's still gonna hurt a little bit, but once that's done, he's gonna stop, he's gonna let you recover, and then things will be okay from there, okay? If it's traumatic the first time, it's gonna be a long time before you're gonna want there to be a second time, okay? That's just reality. All right, so let's go on to what some other things that girls go through, and first one we're going to look at, this is the oldest guy known to father a child. He was 96. Notice the girl looks like she's like 30. That's a little scary too. Girls, the first test we're going to look at is called the PAP exam. Go ahead and write the green. Hopefully I gave you enough room. If I didn't give you enough room, just move over to the guy's side a little bit because there's not much else going over there.
Done.
Okay, so this is a test. It was named after a guy named like Papalova or something like that. And it's done to detect if there's cancer on the cervix, okay? Cervical cancer for women is one of the leading cancer deaths for women. So this is a test that's really important. When I was your age, we started this test at 18 and we had to do it every year. Recent, because of insurance, because of cost of medicine, because of all the other stuff going on, they've now decided, girls, that unless you are sexually active, you start this at 21. If you're sexually active, you go to a doctor for birth control, they're going to do this test, okay? If they don't, you need a different doctor, because they're gonna do this. They're gonna do it at 21, and then every year until you are in a monogamous, settled relationship. What's monogamous mean? One person. One person only, okay? If you're with people one after the other or not in a consistent thing, then there's more risk of disease. Once you're with one person and you're going to be with them forever, if you don't have a disease and they don't have a disease, you're not going to create a disease by being together, okay? So they are now saying every 3 to 4 years, depending on your doctor, that you go in and have this procedure. When you go in, ladies are going to use this little tool here. It's called a speculum. They come in multiple shapes. So first thing the nurse is going to ask you is, are you sexually active? Be honest, because in a few seconds they're going to know anyway. Okay? And if you are not sexually active, they're going to use one of these that's very small, and it won't hurt you. Okay? So this little thing, they're either plastic or aluminum, depends on your doctor. Your doctor will be kind, and they will warm this thing up, and they will put a lubrication on the outside of it, like KY jelly kind of stuff. They're going to put it inside of the vagina. Now, this is where I usually hear, yeah, it hurts. The vagina's muscle. What do we do with muscle when we're nervous? We tense. And if you tense that area, yes, it's going to hurt, okay? You guys are experts at putting your brain somewhere else. That's what you got to do when you're doing this, okay? My doctor and her husband raise dogs. We talk about dogs the whole time she's doing this. All right, and my words to her typically are, you remember that I teach this, I do not need play-by-play, just do your thing. All right, she does, I'm out of there, no big deal. Okay? Old days, when you did this at 18, a parent had to go with you. Now at 21, that's not the case. My dad went with me. You want to talk weird? My dad went with me for this. And I'm glad he was there, but it was very, very weird. So once that's in there, they're going to open the speculum up, and from there, the doctor can see all the way into the cervix. What they should see is this bottom middle picture. All right, that's healthy pink tissue. This right here is what has to stretch to 10 centimeters for the baby to come out. Okay? If they look in and they see this, it's cancer. If they look in and see this, it's herpes. And they can see that from looking inside. As I'm seeing phones, put them away. They're going to take that inside. They're going to take a Q-tip that's about this long. Gentlemen, it's the same Q-tip that they would use to test you for STDs as well. They will put that inside. They will rub it against the opening of the cervix. That comes out. They send it to the lab. A couple weeks later, you get an email that says all is good. Okay? Or we need to see you. Once that's done, anybody ever watch like SVU, where they're doing like crime kits or sex kits, that kind of thing? Once that's done, they're going to take this speculum out and they're going to do what's called a pelvic exam. This is the worst part of this whole thing. Okay? The doctor is going to put a couple of fingers inside of you. Okay? Once they do that, they put their hand on top. They can actually get your ovaries between their hands. And they're going to rotate, and if there's any pain, then they know there's something they need to take care of. There shouldn't be any pain. Okay? Once that's done, they do a breast exam, you're out the door. This whole process may be 10 minutes. Okay? It takes way longer for them to do your blood pressure and your pulse rate and for you to get prepared for this. It takes way longer to do that than the actual procedure itself takes. Okay? Gentlemen, why do you need to know this? One day you're going to have a wife. She's going to have to go through this. And you don't want her to have to go through cervical cancer because that is an ugly situation. Okay? This is just something that you kind of need to know about what that other person is going through. All right? Second one is called menopause. For a lot of you, if your mamas are upper 40s, early 50s, maybe grandma is at that age point, this is something she's dealing with right now. Okay? If your mama is really kind and sweet one minute, ripping your head off the next, it might be a mood swing that goes with menopause. Now, please don't go home and she's in a bad mood and say, are you having menopause? Don't do that, that'll get you smacked, okay? But chances are, that's a thing. Hot flashes. And I'm telling you, I'm always hot. Mrs. Farrow and I have talked about that. We both have fans on all the time because we're always hot.
Yeah.
But these hot flashes are literally like somebody lights a fire and turns the faucet on. Right? The sweat is ridiculous that goes with this. I have a friend that was having them so badly that she would get up in the morning or get up in the middle of the night and have to change her bed sheets because she had sweat so much
I took a
that
shower.
she had to change them. And then she got to the point where she would get up and her kids were both out of the house and she'd go sleep in somebody else's bed because she was just so sweaty that it was gross, okay? You know, we talk about those weird food cravings when a woman's pregnant. That happens here too, okay? She may have some weird food craving. All of a sudden that is just something she can't live without. This is all part of that, remember I said puberty was coming up, menopause is going down. So this is all part of that going down process. When this is done, no more periods, which also means no more chance of babies. Okay, that part shuts down. Now here's the question. Once she's gone through menopause, can she still have sex? Sure. But those products like KY jelly and that kind of stuff, those products are made for this woman. Because her body may not be able to take care of that itself. Okay, the lubrication process. So that's why those products exist, is for this woman. Okay? This one is a hysterectomy. Again, get the green, and then we'll talk about why they would do this. Okay, so a hysterectomy, they're going to go in for a specific reason, and they're going to take out her uterus. Okay? Now, those reasons might be if she's had cancer. That might be if she's having severe bleeding. Now, gentlemen, typically a girl has a period once a month. Here's your too much information for the morning. When I started through this menopause thing, I bled for 7 months straight. No stop. And I went to the doctor and I said, you fix this or we're going to take these parts out. All right, so we did a procedure that fixed it, all taken care of, and there hasn't been anything since. Not abnormal, girls, for you to either not have a period for several months, also not abnormal during puberty for you to bleed for 10 or 12 days and then have it stop and start. It's just part of the puberty process. Okay? And in this case, it's part of the shutting down process. This also might happen in the case of childbirth. If something happens and her bladder gets detached, she can't control going to the bathroom anymore. They may actually go in and do this procedure for that. They also could do it if she was just having a lot of pain. Okay? Now, I know that looks kind of like a cow's head. Let me go back a few slides because I want to show you what this really looks like. Okay, so the uterus is right here. For this procedure, they would go in through the vagina and they would take out the uterus. Now, they can take out the uterus and do a partial hysterectomy, or they can take out all of those parts to do a full hysterectomy. Most doctors would rather just take the uterus because then she will still ovulate, she will still her body will still produce estrogen as much as possible, and it won't put her into menopause. If they take all the parts out, she automatically goes into menopause. Okay? And that's kind of a big deal, depending on the age of a woman. Now, ladies, you cannot go into your doctor and say, you know what, doc, I'm sick of having periods. Would you just take this stuff out? Every doctor will say no to that. Okay? This is a pretty big surgery. It's a pretty big deal. And no doctor is going to do that. The cervix that we talked about just a minute ago is right here. This right here has to open to 10 centimeters for the baby to come out. Okay? Am I connecting the pictures enough? Does that make sense? One more thing for male and female. All right, so we'll talk, I think, female first. I'm not positive of that. When you get to a point where you've had your babies, you've decided, okay, we're done with this, I don't want it anymore. No woman's body should be on birth control for a really long period of time. So there is a surgical procedure for male and female, okay? Quiz time on Friday, guarantee you, I'm going to ask you the difference between these two procedures. Okay, so make sure you understand it. The first one is for the female, and it is called a tubal ligation.
I just think
Okay, so girls, this is a procedure. Typically now they go in through the vagina, and they're going to get these tubes. This one here is actually upside down, but they're going to find these tubes, which are the fallopian tubes. They're going to cut them, and most of the time now they fold them back on themselves and they put a band around them. Okay, she still ovulates, everything still happens, she still has periods, but there's no more egg going to get through that could possibly be fertilized. Ladies, for you to do this, it's a surgical procedure. Okay? Yes, it could be reversed. Most doctors in our area will say absolutely not. Okay? Because it's a huge surgery, and it's a real tricky thing to put everything back together. Now, 99.5% effective birth control, there's always, they can never say it's 100% because if they did, then it would be a lawsuit. Okay? Here's a question for you. If you go in to have this procedure done, your insurance or your family's insurance will pay 100% of this procedure. Why would they do that? They don't pay 100% of anything. Why would they pay 100% of permanent birth control? It is a big surgery, but why would they pay for it? What is paying for this procedure preventing? A child, okay? You guys are on your parents' insurance until you're 26 years old. They pay $5,000 to do this procedure. They eliminate 26 years worth of broken bones, appendicitis, flus, coronavirus. They prevent all of that. So it's cost effective for the insurance company to say, yep, we will take care of this, okay? Now, gentlemen, go back onto the right side of your paper for vasectomy. Here's your version of this. Again, minor procedure. Girls, it's a little more of a major procedure for you. For guys, it's pretty minor. Guys, you do this, you go to the doctor's office, 30 minutes later you walk out with a Band-Aid. So gentlemen, when you have that wife that you love more than anything in the world, this is a procedure you do instead of her. Because for you, it's a minor procedure. For her, it's surgery.
Yep, just like my husband did.
Yep. For you, it's an easy recovery. And yes, they're going to make a little incision on the testicle. You will all survive that. For her, it's a surgical procedure. I have a friend that has 4 children. They decided they didn't want any more. He went on his own. They didn't plan this together. He went and had this done, took the paper from the doctor, rolled it up, put a bow on it, and gave it to her as an anniversary gift. And her response was, you never have to buy me another thing as long as we live. Because think of what that eliminated for her. Okay? She didn't have to worry about all that stuff anymore. Because as a woman gets older, birth control can cause some serious issues. Okay? Remember the cost for the female was like $5,900 to $10,000? Guys, $500 to $1,000. No emergency or no surgery room, no surgical nurses, none of that kind of stuff. This is a doctor and a nurse. They're going to make a little tiny incision right here on the top of the scrotal sac, It's about half the size of a staple, okay? They'll pull the tube out, they'll cut it in half, just like they did for the girl. They'll band them off and put a Band-Aid on. Now, gentlemen, here's the win-win for you. When this is done, the doctor will give you a couple sets of instructions. The first one, keep the area clean and dry until the incision itself is healed. No stitches, all right? Just keep it clean and dry until everything's taken care of. When it has been taken care of, for the next couple of months, they still have to use condoms because they have to make sure that everything is good. But for the next couple of months, have sex as much as you possibly can to make sure that everything is working properly. Gentlemen, not a single one of you is going to look at the doctor and say, I don't want to do that. Okay? And gentlemen, that gives you permission to look at your wife and say, doctor said we have to. Okay? So this is a win-win. It's permanent, but we live in a world of second and third marriages. For the guy, this is pretty easy to reverse one time. Okay? So he's had his children with the first wife, they divorce, he marries another little young thing that wants a baby. It still could be reversed one time. It's very expensive, but it could happen. Okay? Questions over anything on that paper? You can stop.